Nice to have some new faces here. I'm on the medical board, and the reason why I got involved in this company is because of basically the product. MOXXOR is like nothing else out there. Greenlip Mussel's like nothing else out there, and the grapeseed extract is like nothing else out there. And what I want to do tonight is explain to you what omegas do, what antioxidants do, and how in the medical world it actually is very relevant, and then in your world how it's relevant. And if you have any questions, please feel free to ask. Okay? Real quickly, omega-3s are really the basis for every cell in the body. And when you look at a cell, you have, oh, here we go. I just have to throw that one away. Every week I think I get the same pen that doesn't work. We'll keep going. I think the problem is I just put them back here every week also. All right, let's look at this one. Nice blue. I should take this on the road, huh? Let's keep going. All right, green. Who likes green? Again. All right. So basically, every cell membrane of every cell in the body is supported by phospholipids. And these are basically what omega-3s are. So they're like the fortress of the cell. And when a cell is damaged either from free radicals, oxidative stress, from injury from working out, from tissue damage, from autoimmune problems like arthritis or rheumatoid arthritis or Crohn's disease or psoriasis, they basically secrete enzymes that basically start the inflammatory cascade. And some of those are interleukins, some are cytokines, and some are called tissue necrosis factor. And what those do is those start the cascade of inflammation. And at the end of inflammation, what you feel is pain. And that's the body's response to the inflammatory cascade. So what omegas do is they really go at the cell membrane and stabilize the cell to help prevent this from ever occurring. Okay? What antioxidants do is they help prevent the cell from being damaged from free radicals. Free radicals are electrons basically out there that don't have a partner, and they are looking to bind to something. And what they do is they bind to cells and then damage that cell. So a free radical will come in, it has an affinity for cells, and then damages that cell, causes the inflammatory cascade. What antioxidants do is they come in and they grab that free radical and bind to it before it can cause any cellular damage. So this is a very simple explanation as why antioxidants are preventative, and also why they're very important in anti-aging medicine, because they help defend each cell. This is why omega-3s are great in preventative medicine, because they help prevent inflammation. And inflammation really is one of the causes of almost every disease process out there, whether it's coronary artery disease or Alzheimer's or skin disorders or rheumatoid arthritis. All these things are really based with inflammation. What we typically do in medicine is we concentrate on this inflammatory cascade because this is what the patient's complaining of. My knee hurts, my back hurts, my head hurts. So we give medications that come in here and stop that from happening. And when you stop that from happening, you don't feel the pain. And it's very normal in medicine. People come in, have complaints. We write prescriptions. And one of the reasons why I stand up here and I speak to doctors and patients and distributors and people is really to educate them not only what anti-inflammatories do and what drugs do, but what a natural approach with omega-3s and antioxidants can do that's actually way more beneficial. When you block this cascade, the great thing about anti-inflammatories, they're really, really good at doing this. But the problem is they block other cascades also. And one of the most common one is it blocks the protective mucosa of the GI system, basically your stomach. So in the GI system, if you block that, it's a side effect of anti-inflammatories, you end up getting a stomach ulcer. So one of the most common causes of anti-inflammatory use over a period of time is that people get dyspepsia, they get reflux, or they end up getting ulcers. And between over-the-counter anti-inflammatories and prescription anti-inflammatories, about 30 to 34,000 people die a year from bleeding ulcers or kidney disease. So this is really a significant issue. It just doesn't get, it's not as known as well as it really should be. So as I mentioned, another process that can be affected is the renal system. And the renal system is basically your kidneys. Oop. And that's one of the side effects of anti-inflammatories. And when someone's on anti-inflammatories for about 3 months, they should have their blood checked to make sure that they don't have a decrease in their renal function. Very, very important. So what a lot of the pharmaceutical companies did, about 3 in specific, is they said, well, we understand the side effect. This is the biggest problem that people complain of. A lot of deaths are attributed to that, a lot of medical expenses. So let's try to create an anti-inflammatory that doesn't have that. And that's where COX-2 inhibitors came from. COX-2 inhibitors were really good because they were great as an anti-inflammatory. They had less incidence of GI problems. But what started happening is people started having cardiac events. And so there was a higher incidence of heart attacks because it was blocking some normal function of the cardiovascular system. And the great example is Vioxx. Vioxx was researched, and it was so great at a pain as an anti-inflammatory, but then they started seeing what was happening is that more and more people were having heart attacks. And then Vioxx finally got pulled. And up to about a year after people stopped taking Vioxx, they still have an increased risk of cardiovascular events. And that research just came out about 6 weeks to 2 months ago. So when you look at medicine, allopathic or general medicine is really on this side of the equation, and preventative and holistic medicine is really on this side of the question, or on the equation. It's really preventing the cell from ever being damaged in the first place, or stabilizing the cell so there's less of the cascade occurring. In about 15, 20 years ago, the American Heart Association said that people should have a high diet in fish, or they should supplement with omega-3s. And the reason why is that the omega-3s help stabilize the cells of the blood vessel walls, which decreases inflammation, which decreases the aggregation of cholesterol plaques. So if you look at a blood vessel, sorry, I'm standing right in front. If you look at a blood vessel, and I might have to change pens again, there is just inherently there's inflammation throughout our body, and that has to do a lot with stress or cortisol levels or, again, free radicals. But in the coronary vessels specifically, there's no question that there's inflammation. And what happens is that the body has its own defense mechanism against damage to the vessels, and that's one of the purposes of cholesterol. So when cholesterol goes through your blood, if there's an injury to basically the vessel wall, cholesterol kind of goes and attaches to it and creates almost like a clot over that. And with time, those plaques get calcified. So a calcified plaque is an old plaque. Well, traditional medicine will say, let's decrease the amount of cholesterol we have so you don't have as much of this. Alternative medicine will say, well, let's decrease the inflammation so the cholesterol never sticks to it. And in actuality, they both are right. We really need both of those to help decrease coronary artery disease and stroke risk. This is also the example of why people who have diabetes get peripheral vascular disease in their legs and have more infections and have poor sensation.